Let me ask you something that might hit close to home. Do you wake up feeling less like a man than you used to? I'm not talking about your confidence or your motivation. I'm talking about that silent, unmistakable signal your body used to send every morning. The one that let you know, hey, things are still working down there. Now, for many men over 60, that signal fades without warning, and most of them assume it's just age. But here's what they don't realize: it might be the way they sleep. No pills, no trauma, just gravity, posture, and pressure in all the wrong places. A few months ago, a man named Harold came into my clinic. He was 68, still active, no major health issues, but he hadn't had a morning erection in over a year. He was worried something was permanently broken, but what we found shocked him. It wasn't his testosterone, it wasn't his blood pressure, it was his pillow, and the position he slept in every single night. I've been a board-certified urologist for over 30 years, and I can tell you some of the biggest threats to your vitality don't come from disease. They come from neglect. So let's change that together, and if this message hits home, type 1 in the comments. If not, type 2 so I know who I need to reach better. 1. Let me take you back to something most men never think twice about: the way we position our bodies at night. Not the mattress, not the blanket. I'm talking about the actual posture you fall asleep in. Backside stomach. It seems harmless, even irrelevant, doesn't it? But what if I told you that the very way your body settles into that mattress could be silently reducing blood flow to one of the most essential areas for male health, your penis? It sounds dramatic, but it's not an exaggeration. Over the past 3 decades, I've seen hundreds of men who complain of decreased erectile firmness, poor sensation, or complete absence of morning erections. And while hormones and age do play a role, the real culprit is often something much simpler: poor circulation from compressive sleeping positions. Think about this. When you sleep on your stomach, or even with your legs twisted or a pillow too high, what happens? You create pressure on your lower abdomen and pelvis. That pressure, night after night, compresses the arteries that are supposed to carry oxygen-rich blood into the corpora cavernosa, the chambers that allow your penis to become and stay erect. The arteries feeding that region aren't as big or flexible as those in your heart. They're smaller, more fragile, and incredibly sensitive to pressure. Just like a garden hose with a foot pressed halfway down its length, the flow becomes weaker, sputtery, inconsistent. It's the same with your blood flow. Now imagine doing that for 6 to 8 hours a night, every night for years. I remember one patient, Carlos, age 72. He was healthy, walked daily, ate well, but he noticed his erections had become unreliable. His testosterone levels were fine. His stress was low. But he mentioned almost as a joke that he always slept in a fetal position with one leg tucked under his groin. That one habit. It was cutting off the femoral artery supply down to his pelvis. We adjusted his sleeping position, gave it a few weeks. He came back and told me his morning erections had returned for the first time in years. Now, this isn't magic, it's anatomy. A study published in the Journal of Sexual Medicine found that even slight compression of pelvic arteries can decrease nighttime penile tumescence, those subconscious erections men have in their sleep that are crucial for maintaining vascular health and elasticity. This is important. Nocturnal erections aren't just signs of libido. They're like stretch exercises for your vascular system. They help keep tissues oxygenated, flexible, alive. So when blood flow gets disrupted regularly due to how you sleep, it's not just about performance, it's about preservation. If you're waking up softer or not at all, don't just blame age. Look at your body's position during the only time it's completely still. It might be quietly sabotaging your function one night at a time. Change doesn't always start with medicine. Sometimes it starts with a pillow shift, a leg reposition, or flipping from stomach to side, and that can make all the difference. 2. Let's talk about the most damaging position of them all: stomach sleeping. It may feel comfortable for your back or your shoulders, but for your sexual health, it's like placing a lid over a boiling pot and tightening it every night. Now, I'm not exaggerating here. Sleeping on your stomach compresses nearly every major artery that supports your lower abdominal region, especially the internal pudendal artery, which is the key highway for blood traveling to the penis. You lie face down, hips pressing into the mattress groin, flattened under your body weight, and that soft tissue that's supposed to fill with blood at night, it gets robbed, quietly, consistently. I had a patient named Everett. He was 65, retired from construction, lean, strong, and proud of the fact that he never needed pills. But then something changed, gradually, subtly. He noticed his erections weren't just softer, they were absent. no morning wood, no nighttime signals. At first he blamed it on stress or aging, but in our conversation one detail caught my attention. He said he'd always been a stomach sleeper, since childhood. He never once considered that position could affect something so far below his conscious control. So we did a simple test. I asked him to sleep on his side for 3 weeks. Nothing fancy, no new supplements, just a shift in posture. By the 3rd week, he walked into my office smiling. "Doc," he said, "I woke up and felt like I was 30 again. Now, was that an overstatement? Maybe. But the science backs it up. When you sleep on your stomach, the downward force not only reduces arterial flow, but it also adds unnecessary pressure on the perineum, the area between the scrotum and anus. That's a highly sensitive region full of nerves and blood vessels. Consistent compression there doesn't just cut off circulation, it also desensitizes the nerve endings that send signals back to the brain during arousal. Over time, this desensitization may lead to what we call neurovascular compromise, a situation where both the blood and the nerve supply are reduced. That's a double threat. And the worst part, you don't feel it happening. There's no pain, no tingling, no warning signs. You just wake up one morning and realize things don't respond like they used to. One academic study from the American Journal of Urology reviewed sleep postures in aging men and found that over 60% of those with erectile dysfunction reported habitual stomach sleeping versus less than 20% in those without dysfunction. Correlation? Yes, but one that's too strong to ignore. Stomach sleeping also shifts your pelvis into a tilted position. This can cause tightening of the hip flexors, compression of the lumbar spine, and ultimately strain the nerves that feed into the pelvic floor. And what's worse, the longer you stay in that position, the more your body adapts to it, leading to long-term restriction of blood flow and oxygenation during your natural nocturnal erections. So here's the big takeaway. Sleeping face down might be one of the most silent, unrecognized contributors to sexual decline in men over 60. You don't have to believe me right away. Try it for yourself. Change nothing else, no diets, no meds, just flip over. Sleep on your side. Put a pillow between your knees to support your spine. Give it 3 weeks, and then tell me if you wake up different. 3. Let me ask you something you might not have said out loud. When was the last time you had a strong morning erection? Not one that faded in seconds. Not one that felt half awake. I mean a real involuntary sign that your body's systems were firing properly without you even thinking about it. Because here's the truth for men over 60, that morning wood isn't just a leftover from our younger years, it's a crucial diagnostic tool. I once had a patient, Clarence, who was 67, still played tennis on weekends and felt like he was doing pretty well. Except for one thing. He hadn't woken up with an erection in over 6 months. He said it casually, like it wasn't a big deal. I guess that part of my life is just fading away. But I looked him right in the eye and said, "Clarence, it's not just about sex. It's about circulation hormones and even your heart health. See morning erections. What we call nocturnal penile tumescence aren't about desire. They happen during the REM cycle, when your body releases small bursts of testosterone and your nervous system triggers blood flow to keep your erectile tissue alive and elastic. It's like a gym session for your penis while you sleep. When that stops happening, it's not about getting old. It's your body waving a red flag. Now you might be thinking, but I still feel fine otherwise. I'm active, I eat well, I sleep okay. That's exactly what Clarence said. And he did everything right except one thing. He slept every night with a pillow under his stomach, slightly face down, and one leg twisted across his body. That position blocked pelvic circulation and disrupted the subtle neurological feedback loop that's supposed to activate during REM sleep. The pelvic region, especially the pudendal nerve and the deep dorsal artery, needs room to breathe. It needs space to function, stretch, and pulse in rhythm with your heartbeat. When that's interrupted over and over during sleep, those essential nighttime erections vanish. Not because your body is failing, but because you're unknowingly suffocating the very systems meant to keep things alive. A landmark study out of Stanford looked at over 500 men aged 60 to 75 and found a direct correlation between loss of nocturnal erections and future risk of cardiovascular events. That's right, erection quality and heart health are deeply connected, because the arteries to your penis. They're some of the smallest in your body. When they begin to fail, it's often the first signal that larger arteries like those in your heart may be struggling too. So no, this isn't vanity. This isn't midlife crisis. This is your body telling you, pay attention. And the scary thing is, if you're sleeping in a way that chronically reduces pelvic blood flow, you're removing the chance for your body to restore itself. Every night without an erection is like one less maintenance cycle for your male health. Clarence didn't need medication. He didn't need therapy. He needed a foam knee pillow, a side sleep position, and time. After 5 weeks, his morning wood returned. Not every day, but enough to tell him, "You're still here. Your body's still got fight left." If you've stopped checking for morning signs, maybe it's time to start again. Not for ego, but for insight. 4. Let's take this conversation one layer deeper. Because for some of you, the issue might not just be blood flow. It could be pressure. Silent creeping pressure on one of the most misunderstood yet essential glands in the male body, the prostate. Now, I know a lot of men don't like to talk about it. The word alone prostate makes some guys uncomfortable. But here's the thing, if you're over 60 and waking up at night to pee more than once feeling less control or noticing weaker flow, it's probably not just normal aging. And yes, your sleep position could be making it worse. A man named Frank, 69, retired school principal, came to see me with complaints that he was waking up 5 or 6 times a night to urinate. No pain, no burning, just constant interruptions. At first he assumed it was his bladder aging, but after a thorough look we realized it wasn't about his bladder at all. It was inflammation. His prostate was swollen sensitive, and guess what? He'd been sleeping in a curled position, knees to chest with direct pressure, pressing upward on his lower belly for years. See, the prostate sits just below the bladder, wrapped around the urethra like a donut around a straw. When inflamed even slightly, it can restrict urine flow, irritate nerves, and create that constant gotta-go feeling. But here's what's rarely discussed. Poor sleep posture, especially positions that apply abdominal pressure or tighten the pelvic floor, can subtly aggravate the prostate night after night. The longer that compression lasts, the more blood gets trapped, lymph drains poorly, and inflammation builds. This chronic low-level pressure doesn't always cause pain, but it can magnify urinary symptoms and reduce the body's natural ability to flush fluids and recover. And here's the twist. Prostate inflammation doesn't just affect urination. It also disrupts erections. When your prostate is irritated, your pelvic muscles tighten. That tension affects the muscles and nerves responsible for achieving and maintaining arousal. Academic literature often points to urogenital myofascial tension, a term that basically means the muscles and connective tissues around your pelvis become so tight they interfere with function. And what's one major contributor to that tightness? Sleeping curled up, or sleeping in a way that forces your legs to compress your groin and lower belly. I tell my patients all the time, your prostate doesn't need you to baby it, it needs you to give it space. You don't need fancy gear. Start with a lower pillow that doesn't tilt your neck too far forward. Sleep on your side with knees slightly bent, not curled. Place a small pillow between your legs to keep your hips aligned. And most importantly, avoid any position that puts consistent pressure on your lower belly, groin, or perineum. Frank made those changes. 3 weeks later, he came back and said, "Doc, I'm finally sleeping through the night again." And not just sleeping functioning. He felt less urgency, more control, and yes, more strength when it counted. So, if you're dealing with urinary issues and weaker erections, don't just look at pills or blame your age. Look at your mattress, your knees, your habits. Sometimes what's hurting you isn't inside, it's how you're laying on it. 5. By now you might be wondering, okay doc, so I shouldn't sleep on my stomach, I shouldn't curl up like a pretzel, but what should I do instead? I get that question more than you'd think. And here's the good news, you don't need to overhaul your entire bedtime routine. You don't need a new mattress. You don't need expensive gadgets or wearables. You just need to make a few intentional adjustments, the kind that support blood flow, reduce pelvic pressure, and actually allow your body to heal while you sleep. Let's start with the basics. The ideal sleep position for men over 60 is side sleeping, preferably on your left side with your knees slightly bent and a small pillow between them. Why the left side? It helps with circulation, takes pressure off the liver, and most importantly, eases strain on the inferior vena cava, the large vein that brings blood back from your legs and pelvis to your heart. It's the kind of anatomical shift that might sound small, but it has a ripple effect on your entire vascular system. I remember Jerome, a 66-year-old jazz musician who came to me frustrated after trying supplements, diets, and even testosterone gels with no lasting improvement. We changed nothing except his sleeping position. I gave him 3 tips. 1. Lower your pillow. Keep your head in line with your spine. 2. Sleep on your left side with support between your knees. 3. Stretch your hip flexors for 2 minutes before bed. Within a month, he sent me a voicemail. "Doc, it's working again." Now let's break those tips down. Lower pillow height. When your head is tilted too far forward, your spine curves unnaturally, which can compress nerves along the lower back. That compression travels. It can disturb the nerve supply to the pelvic floor, disrupting both blood flow and sensation. Side sleeping with leg support. A pillow between the knees does more than provide comfort. It stabilizes your pelvis, prevents twisting at the hips, and keeps the pressure off the perineum, the area most at risk of blood flow restriction when compressed. Gentle hip flexor stretching. If you sit most of the day, your hip flexors tighten and they can pull your pelvis into a forward tilted position even during sleep. That tilt, it increases stress on the pelvic floor and the prostate. A simple lunge stretch or laying quad stretch before bed can undo that tightness. And here's a bonus tip. Go sockless. Cold feet can cause vasoconstriction, narrowing of your blood vessels, which reduces circulation throughout the body. Keeping your feet warm with a light blanket rather than tight socks helps maintain optimal blood flow. These aren't just comfort hacks, they're vascular strategies. Because at this stage in life, your body is no longer bouncing back automatically. You've got to support it intentionally. You wouldn't block the airflow to your bedroom at night, right? So don't block blood flow to the part of you that still wants to feel alive. Jerome's story isn't rare. I've seen dozens of older men regain confidence, energy, and even emotional vitality just from improving how they sleep. Because when blood flows freely, everything else begins to respond, not just physically, mentally, emotionally, spiritually. Sleep isn't passive. It's the one time your body repairs itself. So let it, support it, protect it, not just for better erections, but for a better life. You know, over the years, I've learned that men rarely talk about these things until they feel like something's slipping away. A quiet loss of energy, a fading connection to their body, a sense that what once came naturally now feels distant or worse, gone. But here's what I want to leave you with tonight. You are not broken. You are not past your prime. You're not a lost cause. What you might be is compressed, restricted by habits you didn't even realize were harming you, like the way you sleep. That's the beauty and the curse of the male body. It rarely screams. It whispers. It nudges you gently. Pay attention to this. But if you ignore those whispers, like the fading of your morning wood, or the increased bathroom trips, or that dull lack of sensation, it eventually stops speaking. Don't let it get to that point. Because the truth is, healing is possible. Sometimes it doesn't come in the form of medication or surgery. Sometimes it starts with awareness, with the courage to change one simple thing, your sleeping posture. And that one shift, it can unlock blood flow, revive dormant tissue, and remind you that your body still remembers how to function when given the chance. You don't need to chase youth. You need to support the systems that have quietly supported you for decades. Tonight when you lie down, I want you to pause. Feel where the pressure goes. Notice where your weight settles. Ask yourself, is this position helping me or hurting me? Then make a small change. And listen, really listen to how your body responds. If this message made sense to you, type 1 in the comments. If not, type 0, so I know how to better serve you. You deserve good nights. You deserve strong mornings. You deserve to feel alive again.